Okay, so when you're putting on the mask, make sure that you cover your mouth and nose with the mask, and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it while it's on you. And if you do, clean your hands with alcohol-based hand rub and soap and water.
Replace the mask with a new one as soon as it is damp, and do not reuse single-use masks. To remove the mask, remove it from behind. Do not touch the front of the mask. Discard immediately in a closed bin. Clean hands with alcohol-based hand rub or soap and water.
So to help to prevent the spread of COVID-19, Alberta has implemented new public health restrictions for events. So the following mass gatherings should be cancelled. Events with more than 50 attendees that involve international participants, critical infrastructure staff, seniors, or other high-risk populations. Large events with more than 250 attendees, which include sporting events, conferences, schools, post-secondary institution. Does not include grocery stores, airports, shopping centers, libraries, and casinos. Shopping may be done on off-peak hours. Review possible closing for shopping centers, libraries, and casinos. Events that do not meet this criteria can proceed, but risk mitigation measures must be in place, such as providing sanitizer station, enhancing cleaning protocols, and distancing between attendees.
Is wearing rubber gloves while out in public effective in preventing the new coronavirus infection? No. Regularly washing your bare hands offers more protection against the catching COVID-19 than wearing rubber gloves. You can still pick up COVID-19 contamination on rubber gloves. If you then touch your face, the contamination goes from your glove to your face and can infect you.
So be smart and inform yourself about COVID-19. Follow accurate public health advice from World Health Organization or WHO and your local health authority. Follow the news on the latest COVID-19 updates. To avoid spreading rumors, always check the source you are getting information from and don't spread rumors. Be kind to support loved ones during coronavirus. So check in on them regularly, especially those affected. Encourage them to keep doing what they enjoy. Share the World Health Organization information to manage anxieties. Provide calm and correct advice for your children. So be informed, prepared, smart, and safe to be supportive, careful, alert, and kind.
How can we keep updated? Blood Tri Department of Health activities for influenza and coronavirus are being done every year. This fall in 2019 to 2020, we have been practicing that. In September 2019, we had the annual influenza vaccine in service. In October 2019, we have had our community influenza clinics. November, December, January, February, March, we continually have influenza vaccine clinics every Friday at the health unit. Influenza vaccination percentages for Blood Tri Department of Health has been ongoing. Influenza-like illness surveillance is on a weekly basis until the end of March. We have had 2 cases of influenza or flu in January, February this year. We have infection prevention control and the disaster and emergency work groups and committee meetings. December, we had our risk management committee meeting. We've had IPAC policy meetings. We did our N95 mask fit training. IPAC working groups have been going on steady. The D&E, or disaster and emergencies, again have been meeting regularly. We've been getting coronavirus updates either through telehealth or through information and have been sharing them throughout the community.
So the pandemic was declared on March 11th. So we're just asking everyone to navigate the following websites for current information, which is Alberta Health Coronavirus Update, COVID-19 Global Cases from World Health Organization and Johns Hopkins, Public Health Agency of Canada on Coronavirus Update, World Health Organization Coronavirus Situational Reports. You may call HealthLink at 811 for questions on how to protect yourself and your family. And you could also call our BTDH hotline for COVID-19. And the number is, again, 403-737-8411. Update your household action plans and plan for self-isolation. Plans for changes at work, school, and extracurricular activities.
So some reflections on the COVID-19. How are you feeling now? Did we bust the myths and fears? Did you gain knowledge on the current COVID-19? And do you have any ideas on how to protect yourself and others?
So we're just going to leave you off with the 10 basic things we should know about the virus and how to diminish the risk of transmission. So number 1, clean your hands regularly with an alcohol-based hand rub or wash them with soap and water. Touching your face after touching contaminated surfaces or sick people is one of the ways the virus can be transmitted. By cleaning your hands, you can reduce your risk. Number 2, clean surfaces regularly with disinfectant. For example, kitchen benches and work desks. Number 3, educate yourself about COVID-19. Make sure you have information that comes from reliable resources. Your local or national public health agency, the World Health Organization website, your local health care professionals. Everyone should know the symptoms. For most people, it starts with a fever and a dry cough, not a runny nose. Most people will have mild disease and get better without needing any special care. Number 4, avoid traveling if you have a fever or cough, and if you become sick while on a flight, inform the crew immediately. Once you get home, make contact with the health professional or the numbers that we provided with you earlier and tell them about where you have been.
Number 5, if you cough or sneeze, do it into your sleeve or use a tissue. Dispose of the tissue immediately into a closed rubbish bin and then clean your hands. If you are over 60 years old or if you have an underlying condition like cardiovascular disease, a respiratory condition, or diabetes, if you have a higher risk of developing severe disease, you may wish to take extra precautions to avoid crowded areas or places where you might interact with people who are sick. Number 7, for everyone, if you feel unwell, stay at home and call your doctor or local health professional. He or she will ask some questions about your symptoms, where you have been, and who you have been in contact with. This will help to make sure you get the right advice, are directed to the right health facility, and will prevent you from infecting others. Number 8, if you are sick, stay at home and eat and sleep separately from your family. Use different utensils and cutlery to eat. Number 9, if you develop shortness of breath, call your doctor and seek care immediately. Number 10, it's normal and understandable to feel anxious, especially if you live in a country or community that has been affected. Find out what you can do in your community. Discuss how to stay safe with your workplace, school, or place of worship.
Okay, so that is the end of our COVID-19 presentation. So we're just going to leave you with Dr. Tedros' wise words. So together we are powerful. Containment starts with you. Our greatest enemy right now is not the virus itself, it's fear, rumors, and stigma. And our greatest assets are our facts, reason, and solidarity. Thank you very much.
Thank you.